Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Samuel here with us this afternoon. And Samuel flew all the way down here from Connecticut to see me today because he has a huge herniation at his C5, C6 vertebral level. I just looked at his x-rays and his MRI, and he's got a huge herniation there that is causing cervical thoracic radiculopathy out of his brachial plexus, going out into his shoulder, out into his arm, and all the way down into his hands and fingers. And he's got paresthesia, specifically in the C6 dermatome, which comes out between C5 and C6, where he has the herniation. But he's also got a little bit here in his pinky finger, that's C8. So he's affecting not just the C6 nerve, but also C6, C7, and the 8th cervical nerve comes out between C7 and T1, and that's what he's feeling down in his pinky finger. And he's got a little bit of a increased bump right here where the vertebral prominence is at T1 because his head's forward in his posture. And you told me he'd been wearing a little brace or something to kind of hold that back, and it felt a little better when your head was back up over your spine more, right?
Yes, right. Yep.
The reason we're doing this video with Samuel today, he's got a very common story, and you know, I've been trying to be really nice to the medical profession here as of late, but whenever orthopedic surgeons and neurosurgeons advise patients like they did Samuel, tell them what they did, Samuel. Tell them what they told you not to do.
My MD told me basically, you have a herniated disc and you need to go see a surgeon right away. Basically today was my appointment with the surgeon, but I canceled that to come over here because they told me that you can go with the surgery, but there's a 50% chances that you might get better and you might not get better. And I thought to myself, if that's the case, why don't I try all the other routes before I will go and cut myself and there's no way back.
Right.
So
good thinking.
You know, so I got on a plane and I requested, please fit me in, and the office was really generous to get me in, and here I am, you know.
Yeah.
So.
And I just want to share with the physicians who are watching this, orthopedics, neuros, even GPs, you know, we are part of the healthcare profession, and we treat the spine and the nervous system. We treat neuromusculoskeletal conditions, and we should be working hand in hand with each other for the patient's best interest, not saying, oh, don't go here, don't go there. We refer patients out to orthopedics and neurosurgeons here every week to go get consultations if I feel they have a lesion or a fragmented disc that cannot be corrected with chiropractic adjustments. But Samuel made a very wise decision by going the conservative route first because he has nothing to lose getting this treatment. I mean, this can only help him. It's not going to hurt him. And I've already done his history and examination, and we found out exactly what I needed to know to adjust him properly. Was that thorough, by the way?
It was very thorough.
Yep.
I'm really happy and glad.
Yeah. I bet it was probably more thorough than what your MD did on you.
That's right. They just look at the report. It's like, yep, you have
herniated disc. You need surgery, injections first, and if that don't work, surgery.
A couple of discs needs to be replaced, and then you're going to be on your own.
There's a paradigm shift in this country and around the world of people just like Samuel who are trying to avoid drugs and surgeries and get chiropractic care as their first line of attacking the problems, which we're really getting down to the underlying cause of the issue, which is vertebral subluxation and misalignment biomechanically that causes neurological compression, and also though degenerates and compresses on the disc. That's when they herniate. When a disc herniates, the little nucleus pulposus, or the gelatin-filled little ball inside the disc, herniates out and it pinches on the nerves, and that's what causes the radiculopathy. So again, like I said, I've already done his examination, and this will be his very first adjustment. Now, a lot of you are still asking, why do I adjust patients on this table first sometimes and then this one sometimes first? When I have new patients like Samuel, I always put them on this BioPhysics table and adjust them first so I can get a feel for their range of motion and their paraspinal muscle hypertonicity or tonicity, or the range of motion of the joint. Let's go ahead and lay you on. You tell me again, Samuel. Sure. So even though he's not complaining of low back pain or problems, or mid back for that matter, I'm still evaluating his entire body and posture. In fact, you can probably see that from the video. See how his right pelvis is elevated up on this right side? His right leg is short by 1/2 inch, which correlates with his SI joint issue right there. His legs get even when I bring it up. That does tighten up a little bit, doesn't it, Samuel?
Yes, it does, right here.
Yeah. So he has a positive knotless in the sacrum here, but he's also got it up in the lower cervical spine when I did that too, because it's causing the spinal cord to stretch and pull, so he's getting some tethering up here. So the very first thing I'm going to adjust on him is his right sacrum and SI joint. There. So I'm not going to talk negatively about the medical profession and the reason that we're in this opioid crisis. I think y'all can figure that out for yourselves. But all this turf war that's going on between medicine and chiropractic needs to stop for the benefit of the patients that we serve. There you go. All right. So see, his hips flatter already, and your legs are now even. This shouldn't tighten up as much as that first one did.
That's right.
Good. Okay, I'm gonna move on up into your cervical spine and thoracic spine on this one. P to A here at C3-4. Now I'm right on the spinous of C5, pushing that straight forward again because his has retrolestes, gone backwards. That's where the nerve is. That probably was tender, huh? Okay, let's turn you on your back, please, sir.
Sure.
So, you know, there's no amount of drugs or injections that's going to actually fix a herniated disc. That's just hiding the symptoms. Whereas we are physically adjusting. Slide down this way. No, just slide straight down. There you go. Now put both arms straight out to the sides for me, please, Samuel. There you go. Palms up. You know, we work hand in hand with surgeons here in Houston for the patient's best interest. And we get referrals from neurosurgeons and orthopedic surgeons, and we refer out to those surgeons as well. Because there are certain issues that we can't deal with, like a fragmented herniated disc that's laying on the nerve root. I can adjust Samuel from now to never, and he wouldn't get better if that was his case, but it's not. Let's sit your face that way. All right. So these reflexes were still equal and active at 2+ upper and lower. He had 5x5 strength upper and lower, no weakness. That's sore though, isn't it?
Yeah.
There you go.
A little bit, yeah.
Okay. When I moved it around in a range of motion, did that kind of tweak your left side of your
It
neck?
feels better actually.
Yeah, now
It
after
feels
the
good,
adjustment,
yeah.
yeah. Oh, we're just getting started.
Yeah.
There you go. So how you finding the weather here in Houston compared to Connecticut? A little warmer here?
It's just very hot. I come from there,
It's a little
it's extreme
distant.
cold and,
Uh-huh.
you know.
Yeah, it's hot and humid here.
Sure.
But right here, head up this way, please, sir.
Sure.
So, this is a manual spinal neural decompression on the y-axis that I have lovingly nicknamed the ring dinger. Slide down here underneath here. A little bit more. There you go. There we go. Good. So, my specific intention with this adjustment is to contact the base of the occiput with this wet towel in my fingers, do a straight vertical lift, which he's horizontal now, but it's vertical on the y-axis, from his occiput, and I've locked his iliac crest in down here. So, breathe through your nose for me, Samuel. There it is, right there. You should have felt that from your neck all the way down.
I did.
Good. Get this guy out of here. Yeah, looky there, you're still kicking. Now, I'm adjusting right at C5-6 now. Put your hands on your tummy with your left big toe. There it is, right there. Now let me have this one. That's it. That was perfect. Notice my line of drive there was not just rotary, but it was P to A as well, posterior to anterior. Very good. Let's turn sideways, Samuel. Push yourself up with your left arm. Okay, we're gonna stand right here again.
Sure.
And I'm gonna have another look at you now. Let's have you close your eyes and bend your head forward and backwards again. Yep, still pinching a little bit right there. So I'm gonna bounce your muscle spindles with this instrument. And then I'm gonna just stretch this trap out a little bit. Bounce these muscle spindles. Okay. Now, here's your homework. You're gonna pull both shoulders up and back.
Sure.
This is why I don't want you wearing that brace.
Sure.
Because it takes away these muscles that are responsible for exactly what I'm getting ready to show you. See, your head's forward a little bit right.
Yep.
So we're gonna bring your head straight back. Translate left a little bit. Look in the mirror. Yep. Now look backwards at the wall behind you as much as you can. I'm gonna adjust your atlas here. You'll feel a little tap there. Another one there. Now relax. Now try that same movement again, Samuel. Tell me if this feels any different to you. You already got increased range of motion going backwards. That's easier, wasn't it?
Yes, it is.
Yep. Very good. So you actually did survive your very first adjustment here, like contrary to what the medical doctors were telling you.
Yep.
What would you tell our fans around the world about your first experience here at Advanced Chiropractic Relief?
I think it's great, and everybody should try it. You know.
You don't have anything to lose.
Yes, right.
Everything to gain.
That's right.
Including not having the $900,000 surgical bill.
That's right. Yep.
So I saw a patient. We had a patient come in here last week. He brought in his EOB from his insurance company. He had a $970,000 balance on his spine surgery.
Wow.
And it still was having pain and problems.
Yep.
So, you know, you can't undo surgery. You can adjust somebody for 6 months.
That's right.
And still, they can go have surgery later on if they need to. But Samuel made the right decision. I applaud him for doing that.
Thank you very much.
Yeah,
Appreciate it.
thank you for sharing your story with everyone.
That's right. Yep.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we're changing people's lives one spine at a time. We'll see y'all soon.